386 hospitals now owned by private equity firms. 6 things to know. There's a lot more to know. Yes, hospitals and nursing homes, which is why nursing homes are going under and then moving patients out. I did a video about that yesterday. It's happening in other places as well. And there was a study that actually came out yesterday. I don't understand why they needed to do a study. This is just a common sense thing. That says that having hospitals and healthcare owned by private equity firms leads to poor quality of care. Yeah. So there's more than just this problem, but let's just start here. Because let me show you just a few. A few private equity firms dominated the list according to the Private Equity Stakeholder Project. Yes. Apollo Global Management. Thanks all you DEI, American Nurses Association and medical. Thank you so much because you all got on board with this. Let's see. You can see the list. Yeah. This is why where I'm at currently, but this has been going on at many places. It just depends. That a chief nursing officer would, instead of being a safe chief nursing officer and going and being with the nurse that's by herself on a psych unit, she would choose to sit in an office and look at me on a camera so she can find a reason to say, I didn't do this or I didn't do that. Now, when this is all said and done, I will lobby as much as I have to for those type chief nursing officers to be held legally responsible, because nurses were trained. I mean, it's just, I think most nurses know this, maybe some have forgotten it, but the cornerstone of being a nurse is doing the right thing. And what is doing the right thing? It means safety. And yet, I guarantee you, these damn chief nursing officers that are this horrible, they shouldn't be a nurse. But if they are willing to be that unsafe, they know. I mean, these people are willing to be as bad, as scumbag bad, as they know that there's not enough staff, but they know it's not going to change. So when you don't get your work done because it's impossible to do that, then you will be held responsible. So I hope they enjoy the ride. I hope they enjoy their little dictatorship that they're on, because I will do whatever I have to lobby for those chief nursing officers to be held legally responsible for their poor choices. So enjoy it while it lasts, your little dictatorships. And it's not all of them, but seriously, this is a huge problem, okay? And quality of care has been declining. The biggest way you push quality of care back up, one of the biggest, is your staff. They're not going to do it. Equity firms aren't about it. It's all about the bottom dollar. They don't care about patients. That's why those nursing home patients, and it's going to happen more and more, it already is, get left out to dry, shipped all over to somewhere else because they don't care about the quality. Part of this problem, too, is again, the globalist problem. We have a bunch of Republicans and Democrats, but a ton of former Republicans that got in bed with Chinese surveillance companies, got in bed with Chinese, they became lobbyists after they left their political positions, and then got in bed with like some of the companies that Trump had blacklisted. Yes, I haven't mentioned it for a while, so let me bring it up again. When I worked at Northwestern in the middle of COVID, the week of lockdowns, Northwestern put in all of their hospitals from Chicago all the way to the border of Wisconsin, every place they owned, they put in blacklisted Chinese thermal cameras. I took pictures of them. I got the serial numbers off of them, and the serial numbers went back to a Chinese telecom company called Dua. I spent all summer, like 5 times a week, I would say, emailing media after media after media, DOJ after DOJ, over and over and over again, FBI, over again. I mean, I spent a good few months, 4 or 5 months doing it. And the White House. Only the White House got back to me. And it all makes sense now because all of these institutions have been corrupted. Okay, so the reason Trump had blacklisted these 7 telecom services is because, one, they're national security risk, because they can get facial recognition off of you if you're in a mask. And Northwestern closed off all the doors, so we had to be herded into one door. Yeah, so those thermal cameras would pick us up. So everybody, at Northwestern at the top, they got on board with that. They need to be held legally responsible for putting everybody at risk, because what the Communist Party wants is all of our data. Yeah. So, and Hillary Clinton's helped with that. That's why let's get all of the medical records in, one system. Here's what's interesting, though. The freestanding psych hospitals, they're not working off of Epic. Nurses know what Epic is. It's what every hospital's charting system is. Yeah, how convenient. And yet, but the freestanding psych, where I'm at, it's paper charting. I guess it's probably because it's easier to eliminate that way. I'm just guessing, just a joke. Yeah, maybe. So, a little bit more to know. Yep, this came out today. Quality of care declines after private equity takes over hospitals. Finds nationwide analysis. This should have been a no-brainer because the private equity firms do not care. They only care about money. But so do the politicians. And so as long as the media is going to continue to act foolish and say that they're worried about MAGA supporters and they're worried about Trump and his rhetoric, no, I would be more concerned about those scumbag CNN people, scumbag CNBC, MSNBC, all of them, that put their pretty little faces on, but lie their asses off to you and carry on about how Trump's the danger. No. We have plenty of danger in this country. We have a ton of CEOs from hospitals that got in bed with Communist Party agendas, okay, with the CCP, with the globalists. We have nursing associations, medical associations, nursing unions that have all gotten in bed with that. If they're pushing diversity, equity, and inclusion, then they're with the globalists. This is why I say your nursing unions, you think they have your back because they care about your staffing. They do not care. They are saying that. They know what's going on, because as long as they push diversity, equity, and inclusion, they're helping the stakeholders. That's what they're doing. So it says here, over the past decade, private equity firms like Blackstone, Apollo, Global Management, the Carlyle Group, KKR and Company, have deployed more than $340 billion to buy healthcare related operations around the world. In 2019, private equity's healthcare acquisitions reached $79 billion, a record, according to Bain and Company, a consulting firm. Private equity purchases have included rural hospitals, physician practices, nursing homes and hospice centers, air ambulance companies, and healthcare billing management and debt collection systems. Partly as a result of private equity purchases, many formerly doctor-owned practices no longer are. The American Medical Association recently reported that 2008 was the first year in which more physicians were employees. In some parts of healthcare industry, private equity firms dominate, for example, and then it goes into how Team Health is owned by Blackstone. But they've been at this for a long time, and then they get the really, shitty chief nursing officers to do the bidding for the communists. That's even the chief nursing officers don't know that. I don't expect nurses to understand the whole China component here or the communist component, except that understand that globalism is communism, but on a global scale. So the Chinese Communist Party has been working with your CEOs of hospitals, as most especially your big ones, but all over. They wanted all the mergers because then they control more. So the equity firms, they hide behind those. I mean, Blackstone, all of these groups, they're just globalists. They're no different than the CCP. So that's what is destroying quality of care. It won't get better till we have a new leader in who's willing to, arrest these people, okay? Because everything they're doing is wrong. I understand why only the White House got back to my email about the cameras in Northwestern. But none of these people had a right to do any of this. They put all of us at risk, and there needs to be some accountability. I will follow up because there's more to this.